and that is the use of stem cells, looking at foot typing, and also the distal gastric recession. This patient came to see me. She has a posterior tibial tendon rupture, and we identified this under ultrasound. Now the etiology of her rupture, she has pretty severe gastric equinus, and she had a partially subluxed subtalar joint or a overpronation of the foot. So what we opted to treat her with is three things. If you look on this side of her foot here, you see we performed a HyperCure implant here, which stabilized the subtalar joint and gave us a more stable foot. If you look now, foot's stable. Before, when I push on her foot, it would go way out. Now it's a good and stable foot. We also did a distal gastric recession. This is about, how many weeks are we out now? Is this 2 weeks? We're out 3 weeks now. And you can see with the baseball stitching we have here, we'll take the sutures out today. This measurement is about 12 centimeters from where the Achilles insert. Now, one thing I do is I use my hand, because my hand happens to be about that width. So I put my hand around the Achilles, and that's about where the bottom of my suture always begins in most patients. Now, studies have shown that you're safe with about 16.2 centimeters all the way down to around 12. So most of our recession is going to occur a little bit higher here in this direction. Usually we don't resect the whole tendon. If you have to and the tendon does separate a lot, you need to suture it down to the soleus underneath. Now, what we did with the tendon here, we took our ultrasound and we injected the amniotic stem cell into the actual posterior tibial tendon where we identified the rupture. Now, one of the cool things about this is the speed of recovery. Now, let me ask you this. I'm going to ask the patient a couple of questions. Before the surgery, on a scale of 1 to 10, this is only 3 weeks ago, what was your pain level like?
9, 10.
A 9, so it's about 9 or 10. And now we're just 3 weeks later and you're fully weight bearing. Of course, you're in the camel walker, but we're not in a crutch or anything like that. What is your pain now?
Nothing.
It has no pain, so 0 pain in 3 weeks. Now, if you treated this with more extensive procedures, she would definitely have pain. So sometimes you get by with less and get a lot of correction. We have to correct the underlying abnormality, use the stem cell to help augment healing, and then we get a good result. So this is what we're going to get with her. I've seen this a number of times now, and most likely she will do very well with this.